Coconut oil. Most people view coconut oil as a trendy kitchen staple. What they do not know is what happens at a microscopic level when dogs consume it regularly. Coconut oil is rich in lauric acid, a compound shown in studies to fight Streptococcus mutans, one of the primary bacteria responsible for tooth decay and gum disease. It does not just mask bacteria, it disrupts the membrane of bacterial cells and breaks them apart. Use half a teaspoon for small dogs and 1 teaspoon for larger breeds daily. Mix it directly into their food. The key is consistency. 1 week will not show much, but 3 months of daily use is where the difference becomes visible through cleaner teeth, less odor, and healthier gum color. One thing to note, coconut oil is calorie dense. If your dog is already at a healthy weight, slightly reduce their kibble to compensate. The kelp, Ascophyllum nodosum. This next ingredient works completely differently. It does not kill bacteria. It makes it physically impossible for bacteria to stick to your dog's teeth in the first place. The science behind it is cleaner than almost anything else on this list. This specific type of seaweed contains a compound that blocks the enzyme bacteria used to form biofilm. Biofilm is the sticky matrix bacteria create on tooth surfaces. Without biofilm, bacteria cannot attach. Without attachment, plaque cannot form. Without plaque, tartar cannot build up. Multiple peer-reviewed studies have confirmed this mechanism. It is actually the active ingredient in several veterinary dental supplements, but you are getting it straight from the source. Use dried kelp powder, about half a teaspoon per day for medium dogs, sprinkled directly on food. It is odorless, and most dogs genuinely do not notice it, making it work even for picky dogs. Turmeric. While kelp and coconut oil handle the teeth, this ingredient targets a completely different problem, the gums. In dogs, gum disease progresses faster than tooth decay, and most owners are watching the wrong thing entirely. Periodontal disease is an inflammatory condition. The bacteria in plaque trigger an immune response that inflames gum tissue. Over time, that inflammation breaks down the connective tissue and bone holding your dog's teeth in place. That is how dogs lose teeth, not from the outside in, but from the inside out. Curcumin, the active compound in turmeric, is one of the most studied natural anti-inflammatories in existence. In oral health research, it has been shown to reduce gingival inflammation and inhibit the growth of bacteria directly associated with periodontitis. For dogs, use 1 or 8 teaspoons per 10 lbs of body weight mixed into food. Never use more, and always add a tiny pinch of black pepper. Black pepper increases curcumin absorption by up to 2,000% according to research. This combination is a different thing entirely from turmeric alone. Probiotics. What comes next is something that takes most people completely off guard because it does not work in the mouth at all. It works from the inside, and the connection to dental health is more direct than you would expect. The mouth has its own microbiome. When it is out of balance, with too much harmful bacteria and not enough beneficial bacteria, dental disease accelerates. Probiotics do not kill bacteria, they outcompete them. Beneficial bacteria occupy the same attachment sites, consume the same nutrients, and produce compounds like hydrogen peroxide that suppress pathogenic strains. The strains that matter most for oral health specifically are Lactobacillus acidophilus and Streptococcus salivarius. Dog-specific probiotic supplements often include these. If using human probiotics, check the label for these strains by name. Use powder form once daily, mixed into food. Most dogs show noticeable improvement in breath odor within 2 to 3 weeks, which tells you the oral microbiome is shifting. Fresh parsley. This next ingredient might look like a garnish or something you would throw out after cooking, but what it does to dog gum tissue is genuinely impressive and costs almost nothing. Use fresh flat-leaf parsley, not dried. It contains chlorophyll, which directly neutralizes the sulfur compounds responsible for bad breath. Beyond odor, parsley has documented antibacterial properties against specific oral pathogens and contains apigenin, a flavonoid with anti-inflammatory activity in gum tissue. A teaspoon of finely chopped fresh parsley for medium dogs mixed into food is ideal. Do not use parsley seed oil, as that can be toxic. Use the fresh herb only. A bunch of grocery store parsley costs less than most dental chews and lasts a week. This is the most underrated and probably the cheapest item on this list. Raw carrots. Everything so far has worked through chemistry, but this one works through pure physics. Most people underestimate it because it seems too simple. The chewing action on a raw carrot creates mechanical abrasion along the tooth surface. The fibrous texture acts like a brush, physically dislodging food debris and early-stage plaque before it mineralizes into tartar. But there is a layer most owners miss. Carrots are high in beta-carotene, which converts to vitamin A in the body. Vitamin A maintains the integrity of mucosal tissue, including gum tissue. Deficiency is directly linked to increased susceptibility to oral infection. One baby carrot or a piece of regular carrot before meals is enough. The chewing happens naturally and most dogs love them. Bone broth. While raw carrots clean the surface, this ingredient goes deeper, targeting the connective tissue beneath the gum line where serious structural damage quietly accumulates. When you simmer bones for hours, collagen breaks down into gelatin. That gelatin contains proline and glycine, amino acids that are the raw building material for connective tissue, including the periodontal ligament that anchors teeth in the jaw. Dogs with advancing gum disease are losing that connective tissue. Bone broth gives the body what it needs to repair and maintain it. It also contains phosphorus and calcium, minerals that directly contribute to tooth enamel density. Use unsalted onion-free bone broth only. This is critical because commercial broths almost always contain onion, which is toxic to dogs. Make your own or find dog-specific versions. 2 to 3 tablespoons over their regular food is perfect. Strawberries. This ingredient works from the outside and most people would never guess it belongs in a dog bowl. It looks like a treat, but it contains a compound that actively lifts early-stage plaque off tooth enamel. The mechanism behind it was first discovered in human dental research. Strawberries contain malic acid, the same compound found in apple cider vinegar, but delivered in a gentler, whole food form. Research in human dentistry has shown malic acid increases salivary flow and helps remove early-stage plaque from the enamel surface. In dogs, increased saliva production itself is protective. Saliva contains antimicrobial proteins and mechanically washes away food debris between meals. 1 to 2 strawberries, sliced and mixed into food 2 or 3 times per week, is sufficient. Do not give them daily, as the natural sugar content means moderation matters. Remove the tops and slice them small for smaller breeds. Fish oil. This works from the inside out through the bloodstream, hitting gum inflammation at the molecular level. Most owners are already giving it to their dog for a shiny coat, accidentally getting a dental benefit without knowing it. EPA, eicosapentaenoic acid, directly reduces the prostaglandins that drive gum inflammation. It does not just mask the inflammation, it interrupts the biological signaling pathway that creates it. Human periodontal studies show omega-3 supplementation reduces gum pocket depth and slows attachment loss, and the mechanism is identical in dogs. The dosage is 20 to 55 milligrams of EPA and DHA combined per pound of body weight daily. Liquid fish oil squeezed over food works best. Do not use cod liver oil, as the vitamin D concentration reaches toxic levels at dental-relevant doses. Green tea. This works directly on the tooth surface and contains a compound specifically studied in canine oral research for over 2 decades. Green tea has more research behind its oral antibacterial effects than almost any other natural compound. The active compounds are catechins, specifically EGCG, Epigallocatechin gallate. EGCG inhibits the growth of Streptococcus mutans and Porphyromonas gingivalis, 2 of the most destructive oral bacteria in dogs. It also blocks bacterial adherence to tooth surfaces, similar to kelp but through a different mechanism. To give it, brew a weak cup of plain green tea, cool it completely, and add 2 to 3 tablespoons to their food or water bowl. Never serve it hot, sweetened, or with additives. Regarding caffeine, 2 tablespoons diluted in food is a safe amount. If you want to avoid caffeine entirely, dog-specific green tea extract supplements exist. Pumpkin seeds. These go after the enzyme that converts bacterial waste into the compounds that calcify and harden into tartar. Shut down that enzyme, and tartar cannot form normally. Pumpkin seeds are one of the densest natural sources of zinc. Zinc directly inhibits urease, the enzyme bacteria use to convert waste products into ammonia compounds that accelerate tartar formation. reduce urease activity, and you reduce tartar buildup. Zinc also has documented antimicrobial properties against certain oral pathogens. Use raw, unsalted pumpkin seeds, ground or crushed. 1 teaspoon for medium dogs mixed into food is the standard. Grinding matters because whole seeds often pass through dogs without being digested, leaving the zinc locked inside. Freeze-dried, raw, meaty chews. Unlike the powders or liquids mentioned before, this works through something dogs were built to do naturally. Every day, a thin layer of plaque forms on your dog's teeth. At first, it is soft, but if it stays, it hardens into tartar. Freeze-dried raw meaty chews are valuable because they force your dog to chew for longer periods. This creates natural friction against the tooth surface, helping remove food debris and early plaque. Longer chewing also stimulates saliva production, which acts as a built-in mouth cleaner to rinse away bacteria throughout the day. Choose a chew appropriate for your dog's size and always supervise them. Sometimes the best dental support is simply giving your dog something worth chewing. Enzyme water additives. The final item works silently every time your dog takes a drink. Certain veterinary formulated water additives contain glucose oxidase, an enzyme that, in the presence of saliva, produces low-level hydrogen peroxide throughout the day. This acts as a persistent antimicrobial agent, not just once after meals, but consistently all day. The effect compounds over time, creating a sustained low bacterial environment. Look for enzyme-based dental water additives with veterinary recommendations and add the specified amount to their water bowl daily. It is odorless and tasteless, so your dog will never know it is there. What actually matters now is that you do not need all 13 starting tomorrow. Pick 2 or 3 that make the most sense for your dog right now and stay consistent for 30 days. If your dog is young and healthy, kelp powder and coconut oil are the easiest, highest impact starting points. If your dog already shows gum sensitivity or bad breath, add probiotics and bone broth. Even 3 of these used consistently create a compounding effect that no dental chew on the market can match. Drop a comment letting us know which ingredient you are trying first to help other owners. If you want a full rotation plan for maximum benefit, just comment rotation below, and I will build that out in a dedicated video. If these insights change the way you look at your dog's dental health, please subscribe and like the channel. We are uncovering the wellness secrets that have been hidden for too long. Let's protect our pets' futures together. The next health breakthrough will be shared very soon.